There are some big health measures in this year's budget, from new urgent care clinics to a prescription price freeze.
But does it go far enough to address issues in our health system? Let's bring in Dr Nick Coatsworth live from Canberra with more.
Hey, Doc.
Good morning, Doc.
Morning,
now,
guys.
what were the best commitments when it comes to health in the budget?
Sarah, I think Carl just mentioned them. I mean, expanding urgent care clinics and freezing the co-payment for prescriptions are really positive measures. This is very much a pre-election budget, which has a lot of good announceables, but actually what's not in the budget has got aged care workers up in arms today. They were due for somewhere between a 7 to 28% pay rise in this budget, and the Aged Care Minister, Annika Wells, or the Treasurer indeed, has delayed that, split it in half. They'll get half this year and half in 2026. So it seems that aged care is in crisis until it's not, and it's a big surprise for aged care workers not to get that pay rise in this budget.
Look, the other one is Jackie Lambie was pretty upset that $300 was going to a power rebate, not mental health services. Do you concur with that, or do we need to find that money elsewhere for mental health?
Oh, look, I think they're both significant pressures on Australians. I mean, I won't comment on the power bill rebate, but in mental health, this budget does actually deliver. I think there's over $300 million, I think, that going towards phone consultations and sort of constant and regular access to psychologists and psychiatrists. So whilst there's, you know, a lot of fluffy announceables, as there always are with budgets, I think the mental health one is going to have a genuine impact and improvement on all Australians.
Well, we know the impact that has on the community, so it definitely needs to be addressed. But, Doc, I also want to ask you about these new urgent care clinics. We're going to get more of them, but the issue is that we may not have the GPs to actually fill them with.
There's a lot of issues with urgent care clinics, Sarah. One of them is we might not have the GPs. The other one is, are they actually providing urgent care? I had a close colleague who's actually a patient advocate turn up with a small abscess on his foot to an urgent care clinic, and they couldn't actually provide the care, and they sent him to an emergency department. So I think the example there shows you that the government tends to put a lot of money in these things, but then fails to evaluate their effectiveness. Now, we've got a minister, Andrew Leigh, who loves evaluation. I think urgent care clinics need evaluation before more money gets poured into them.
A couple of quick questions on the hottest medical item in the world, it seems, at the moment. New research has revealed that Ozempic jabs could be the key to lowering heart disease deaths. Interesting data.
Yeah.
It's very interesting data. I mean, obviously it's plausible. If you can lose weight, you're going to reduce your risk of heart disease. The degree to which heart disease is reduced with some of these weight loss drugs, Ozempic and Mounjaro, 20%. We've got to remember, Carl, this was a drug company funded study. But I think the important thing is we need supply. We need the drug companies to actually get supply to Australia.
Well, that is the issue. I think that you rightly point out there, Doc. How do we make sure that we're not buying fakes out there?
Well, just don't buy fakes. I mean, look, you really need to buy the brand. At this point in time, I think there's so many problems with fake producers, and you don't know what's in it. You don't even know if there's Ozempic in it. It's turning up with, you know, a vial of orange stuff, which is full of toxic levels of vitamin compounds. You can get toxicity from vitamins, and all sorts of complications are occurring. So if you don't know that it's the drug, then I think at this point in time it's best not to go to these dodgy online compounding places.
Hey there, Today fans, Sarah and...
What's my name again?
Oh my goodness, Carl.
Hey, thanks for watching our YouTube channel, though. Subscribe now for more news, special reports and amazing Aussie stories.
And Carl misbehaving,
Whoa,
of course.
that never happens.
Always happens.
What's she talking about?
Always happens.